With regard to female breast reduction versus lift, that's really the question. You know, some women don't know whether they need a lift or reduction, or sometimes it's a little bit of both.
If you're happy with your volume in the bra, when you put the bra on and you're happy with your volume, I don't think that you need a breast augmentation. What you need is a breast lift.
A lot of people have been online and they've seen pictures of breast lifts and breast reductions, and the pictures look very similar as far as the incisions. It's an anchor pattern.
In general, a lift and a reduction come with the exact same scars. And through that incision pattern, we can either remove breast tissue and skin to just reduce a breast, or we can just remove some skin and lift the breast.
All breasts, men, women, old, young, is always a combination of gland and fat. When we're young, it's more gland, and when we're older, that gland involutes or changes to fat. In an older person who has droop or ptosis, as well as large breasts, and that happens after menopause frequently, it's a little bit different. I'm going to have to create a firmness to that breast gland, which is now fairly fatty, before I reposition it and then drape the skin. So they're different surgeries, although they're very much related.
With one caveat. If you want we call it the superomedial, so the upper central portion of the breast that you would really see outside of a bra. If you want that to have a very projected or more of a cleavage takeoff, especially even outside of a bra, you probably need an implant. So in some of those patients, if they know they want that augmented cleavage look, I'll do it in stages sometimes. And we'll go in and do the lift and the reduction first, get their breasts symmetrical, smaller, and lifted, and then we can come back and put the implant in later. It's safer to do it in 2 stages that way.
And it's fine with me if they bring me photographs of a beautiful breast. That way they want me to see how close to that I can get. I can put that photo up on the monitor in the operating room, and I can see how close I can get to that in surgery. And so there's not a numbers game that you can play with it. It needs to go this many centimeters this way or that many centimeters. You know, it really does comes down to your judgment.
Physically, people have back pain, neck pain. They can get rashes underneath the breast from them drooping and hanging. There can be grooves in the shoulders that people will get that cut in from the bras and the breasts that are just so heavy. And we find that reduction procedures really can reduce those dramatically. And then there's the emotional. Women who have had extremely large breasts since they were young really are often kind of binding themselves, you know, covering up, not wanting all the attention and focus on their chest. And the emotional healing by getting something that's proportional to their size, overall, that can be just as powerful as the physical.